Prof, thank you so much for joining us. So the new figures are just in tonight. 10,510 new infections in the past 24 hours nationally, nearly 7,000 of those in Gauteng. Gauteng is just skyrocketing at the moment. What do you think we're in for in the coming weeks?
So Gauteng is very much ahead of many of the other provinces, and particularly the Western Cape, Eastern Cape and KwaZulu-Natal when it comes to the current resurgence. So we're probably at least 3 to 4 weeks ahead of what is being experienced in the other provinces. Based on the past experience, I suspect that in Gauteng we probably will start peaking towards the end of next week or early the following week. And after that we'll start seeing a decline in the number of cases. But right now, as you know, Gauteng, there's only about 25% of South Africa's population live in Gauteng. Yet we're responsible for close on to two-thirds of all of the cases that are being documented, which is extremely worrisome. But at the same time, there is some silver lining to this, in that although this particular wave, when you look at the number of people that are being infected per 100,000 of the population, is likely to exceed what was experienced during the course of the first and the second wave, the death rate seems to be a bit more subdued. Compared to what we had experienced during the course of the first and the second wave. And that might be a consequence of there being some level of immunity, at least in protecting people against developing severe disease, although despite that the death rate still remains high.
Yeah, I want to talk to you about reinfection because a lot of people might have had COVID with the first wave, which was the original, shall we call it, variant, and then a lot of people who had it with the second wave would have had it with the beta variant, which of course is the variant that was first identified here in South Africa. So if you had the beta variant, let's say at the beginning of this year, are you still immune or not?
So that's a difficult question. What we do know about the original infection with the original variant was that it only conferred about 25% protection from being infected by the beta variant. Now, whether someone that's infected by the beta variant has longer lasting immunity from being reinfected by the beta variant is very likely so. But it's not absolute, because I think what we're seeing in South Africa is a significant amount of waning of antibody, especially where most of these infections are mild or asymptomatic infections. And consequently, when you have that sort of waning of antibody, it does put you at risk of being reinfected with the same variant, because the presence of this new, what we call neutralizing antibody, is extremely important in preventing infection and preventing mild disease. So yes, unfortunately, especially with the large amount of virus that's circulating in South Africa, if you are exposed and you have been previously infected a few months ago, you probably do remain susceptible to being reinfected, but fortunately you're very unlikely to have severe disease when you are reinfected.
I see. So in other words, you shouldn't presume that you won't get reinfected, and indeed reinfections are occurring, but if you survived it once, you're likely to survive it the second time round?
Correct. So once your immune system has been adequately primed, the subsequent infection is usually going to result in a much less severe illness than what you experienced the first time around. Your body is much better equipped to get rid of the virus much quicker and control the ability of the virus to replicate. So you would be relatively protected.
But one shouldn't be complacent, obviously, because you can also pass it on to people who haven't had it. I want to ask for your input on schools. We know that the Education Minister is due to have a briefing tomorrow. Here in Gauteng, I think nearly 4,000 teachers and pupils in total are currently infected. Over 20 schools have closed. First of all, does the beta variant affect kids more? Or is it just it's more transmissible, so more kids are getting it? Prof, were you able to hear me? I think we might have cut out our sound for a second.
Yes, I just missed the last part of it. So I got to, there were 4,000 teachers and students that were infected.
Yes, what I wanted to ask you, is whether the beta variant affects children more, or is it just that the beta variant is more transmissible than the original? Prof, can you hear me now?
Yes, I can.
Okay, I'm going to try that question again. The beta variant, is it more is it affecting kids more? Because I think that's what parents are really scared of. Are kids getting more sick?
So the beta variant is more transmissible, but at the same time, it doesn't mean it's more virulent in that it is more infectious, but the chances of a child ending up in hospital, unless the child has got other sort of an underlying medical condition, is extremely low. So the virulence hasn't changed much. And I think it's also important to recognize that what's occurred in South Africa is that even teachers, as an example, their risk of being infected, in fact, is lower than individuals that are working in the service industry. So I don't believe that the schools necessarily, the closure of the schools would have any meaningful impact when it comes to the circulation of the virus in South Africa, as well as the risk of teachers or children being infected, provided that they're adhering to protocol with COVID prevention measures.
I have to, before I let you go, just ask you about the vaccine rollout. We heard this morning that we are going to see more people open to being vaccinated, and we know that more Pfizer and more Johnson & Johnson vaccines are coming in. Sinovac from China is also being reviewed to be brought into South Africa. But what about Novavax? You have spoken about Novavax a number of times, that it looks really, really effective. Have they applied to SAPRA to be imported into South Africa?
Well, there's consensus in the scientific community that the Novavax vaccine, like the messenger RNA vaccines, are amongst the best of the vaccines, even against the beta variant. But unfortunately, the South African government in the past has indicated that they don't plan on using the Novavax vaccine, so there's very little incentive for the company to apply for authorization or for a registration of its vaccine if government doesn't plan to use it, which is really surprising, because compared to the Sinovac vaccine, the Novavax vaccine will confirm much greater protection, even against the beta variant, and including against mild disease, which the Sinovac vaccine will not protect against when it comes to the beta variant in South Africa.
Is the Novavax vaccine being used elsewhere around the world?
So currently, it's been submitted for authorization as well as for registration in the United Kingdom, as well as in the United States and one or two other countries. So currently there isn't any vaccine being used because it still needs to complete the WHO review, as well as needs to be registered for use.
Could that be the reason the South African government has indicated not at this stage, because it still needs to go through a WHO review?
No, the South African government made this decision a few months ago, when for some reason it decided that the Novavax vaccine was not suited for South Africa because of some concern in relation to its efficacy in people living with HIV in the South African study. But at the same time, that's the only vaccine trial to actually have evaluated a vaccine in people with HIV that was able to provide some sort of indication. So the Novavax vaccine, and probably most of the other COVID vaccines, will have some shortcomings in people living with HIV. But at the end of the day, this applies to any other vaccine, including the Sinovac vaccine and also the Pfizer vaccine. We don't know how well it would work in people with HIV.
So this decision by the South African government, you say, not to pursue the Novavax vaccine, even though it looks really effective, was this a decision by the Health Department or by the Health Products Regulatory Authority?
No, not by the Health Regulatory Authority at all. I think this was a recommendation made by the Ministerial Advisory Committee. And what informed their decisions defies my thinking, because, like I said, the scientific community there's huge consensus that the Novavax vaccine is probably one of the best vaccines, and certainly most suited in the South African context, in that it can actually be also stored at 2 to 8 degrees Celsius.
All right. Well, that's a really important question that I think we need to pursue, and thank you very much for your time.